So just a bit about me to kick us off. As I said, my name's Tess, my pronouns are she, her, and I'm the digital and print content producer at Cancer Council Victoria. I've been here for a bit over 2 years now, and I previously worked in digital content for lifestyle and culture publications. Sounds like a bit of a random detail to mention, but I just wanted to share a bit of background on my career so that you know that I actually come at this from a community perspective. Though I have experience producing content and communicating with specific audiences in the past, I don't have a medical background. What I've learned about cancer and the medical system has largely been through working at Cancer Council. Excuse me. That said, I see it as a bit of a strength in my work because I can see things closer to the way that patients see it. And I particularly see this as the case in my role as the Victorian representative on Cancer Council's National Cancer Information Subcommittee, the NCIS, which is where I review and contribute to the publication of our Understanding Cancer resources. They're the booklets and fact sheets that most of you are probably familiar with given your career, your work. I work closely with these resources throughout the publication process. So from drafting and reviewing them or creating them from scratch to adapting them for our website. I also create other digital content for CCV. Some examples are My Cancer Guide, which is the online directory for cancer support services, and interviewing people affected by cancer so we can elevate their voices and share their lived experiences with others who are going through something similar. Just to also mention, I produce our monthly newsletters to the cancer community and health professionals and engage with the public via social media. So that helps me have a grasp on what our audience is asking for or struggling with. Now, before I share my recommendations for producing patient-facing resources, I thought it might be useful for me to give some background on the key group producing Cancer Council's national resources and the process that we follow. Certainly not just me, there's a lot of people involved. So the National Cancer Information Subcommittee was established by the Supportive Care Committee in 2008, previously called the National Publications Working Group, to look into how we could reduce the duplication of supportive care publications being produced by individual Cancer Council states and territories. Ultimately, the goal was to reduce costs through greater collaboration and the sharing of resources, and develop a generic suite of branded publications for print and digital media, so have a bit more consistency. The group's currently chaired by Jenny Bruce, who's the Manager of Cancer Information in Cancer Council New South Wales, and we meet monthly online with full representation from every state and territory at Cancer Council. To date, we've produced 51 booklets and 19 fact sheets, which have been published as national resources. So to give you a bit of information about our process, each resource in the Understanding Cancer series goes through a thorough internal review, both by the team at Cancer Council New South Wales who produce the publications and by members of the NCIS, such as myself, from each state and territory. From there, the titles are also reviewed by clinical specialists, so that includes nurses and primary specialists for that cancer or treatment type or topic. For example, that could be a surgeon or a hematologist or a psychologist. We also have additional reviewers where appropriate, such as dietitians, for example. Next up, we also have the publications reviewed by our 13, 11, 20 consultants. So they're the nurses or financial counsellors or emotional counsellors on the 13, 11, 20 helpline. We have at least one consultant review the publication based on their expertise and the perspective of what they hear on the phones. And then finally, we, of course, have our consumers chip in, so people diagnosed with cancer, as well as carers, friends or family. And at Cancer Council Victoria, we often draw from the community advisory network for this. It was really interesting having our breakout room conversations before this and hearing about the difficulties that we can face in finding community advisory, community advisors. Really has made me feel quite grateful for the advisory network that we have at Cancer Council, and I think it was a really great point that reaching out to maybe even Cancer Council ourselves or other NGOs to see if they have people who might be available to help. I think that could be a really good idea for anyone who's struggling. So these reviews Reviews that I just mentioned are all done at the draft stage when the publication's in a Word document and comments can be added easily. We also do an additional review in the final PDF format within the NCIS, as well as sub-editing and proofing. So as you can tell, it's a pretty rigorous process and ensures our resources are looked at from the perspective of all sides of the healthcare system. All right, there we go. So moving on to patient-facing resources more generally, enough about me and Cancer Council. It's worth first digging into the idea of health literacy. We know it's effective. We know that effective patient-facing resources can help improve health literacy in patients, but what does that really mean? So health literacy describes how people access, understand, appraise, and use information to manage their health and well-being. So access is the ability to find information as well as the availability of the information for people to find. For example, a person can't learn about their cancer treatment options if there's no information available for them to learn from. And once the information is accessible, it must be delivered in a way that can be understood. So it's the next step, that's understand. Appraise, people should be able to assess whether the information is from a trustworthy source and of high value. Can be very tricky in age of the internet. And use, once people have health information they need and understand that information, they're then able to make informed decisions about their health. Health literacy is shaped by a wide range of societal factors and is therefore not the sole responsibility of individuals to develop and maintain. The way the health system works influences the ability of consumers to make decisions and manage their healthcare, whether that's for the better or for the worse. So every Victorian should have equal access to cancer information support, and there are some broad fundamental guidelines for creating effective resources which help point us in the right direction. Firstly, to create the most helpful resources for patients, it's important to pick the right topic. You want to avoid duplicating with existing publications, and it can be helpful to look for gaps by speaking to clinicians, or if you're a clinician yourself, reflecting on your experiences. Speaking to patients and looking at other service areas. One example that I can speak to is our new Heart Health and Cancer fact sheet, which was produced by Cancer Council based on feedback that the topic was becoming more common in patient discussions, but health professionals didn't have the resources to direct patients to for more information. So that's a gap that we recently filled only in the last couple of months. Next up, language is of course really important for communicating through resources. Here at Cancer Council, we aim for the comprehension level of a year 6 to 8 student. This is because most readers have limited or no knowledge of cancer or its impact, and their normal comprehension level will decrease with the distress of a diagnosis or unfamiliar medical terms. In keeping our language simple, we make the information accessible. And following on from that train of thought, having too much copy can also be overwhelming for readers, particularly those with low literacy levels. Where there's the opportunity, you should consider using visuals like illustrations or graphs to communicate information. I haven't covered it much in this presentation, but other mediums like videos and podcasts are also very worth exploring. Trying to diversify the way that we're speaking to people can be very helpful. And finally, where possible, consider if your audience might benefit from translations like Easy English or languages other than English. If you do follow that path, though, ensure that you consult the right communities and have the resourcing to keep those resources up to date, just as you would with any other resources. So now on to 5 areas which risk tripping us up when we're approaching producing a new patient resource. The first one is that we should use plain English. We want to avoid overcomplicating the language. So use the language of everyday speech. This means basic commonly used words. For example, one that I always pick up is use instead of utilize. I think that we have the habit of wanting to sound smart, of course. Everyone wants to sound smart and expert. But in this particular situation, you want to be as approachable and accessible as possible. So you should write as if you're explaining the subject to a friend or a family member who has no knowledge in the subject area. Avoid jargons or idioms and keep phrases simple and short. Also be sure to use active voice, not passive. Next up is to break up the text with subheadings and focus on short paragraphs, organising the information clearly. That's just a second point of the first common pitfall. Again, as I said, big chunks of text can be quite intimidating and overwhelming for people. So yeah, try to use formatting where you can. Next up, so writing for the wrong audience, you need to make sure that you're thinking about who you're writing for, which in this situation is generally patients. So the writing should convey empathy, but also be practical and realistic. The information should aim to empower readers and see them as whole people. And we should avoid words with negative connotations or which imply a sense of powerlessness. For example, we tend to say people affected by cancer rather than saying patient. It's not a bad word in any way, but some people see it as impersonal. And we also avoid using terms like, affected by cancer rather than diagnosed with cancer, battling cancer, suffering with cancer, things that are a bit more emotive. We try to just keep it a bit more basic. So next, assuming a certain level of existing knowledge, it's really helpful to supply definitions, define clinical terms when they require some explanation, and avoid using medical jargon, as I said before. Use the lay term where possible, and the clinical terms can always be added in brackets if you think it's needed. Also, be sure to always spell out your acronyms. They pop up all the time and you get too used to them, but at least the first time that you say the name of the service or whatever it might be, spell out the acronym and then pop the acronym in brackets after that. Next up, don't recreate what's already out there. As I mentioned a few slides ago, avoid simply duplicating existing information. It's not a good use of resources and it can be quite confusing for the community if they're not sure which one to look at. And if anything, you can consider partnering with other organisations. If there's a topic that you're really keen to cover, that's certainly something that we think about at Cancer Council Victoria. If it's not something that's happened yet, but for example, if we have Understanding Breast Cancer, is there someone we can partner with rather than duplicating each other's work? And finally, the final pitfall is making the resources hard to access. So there's no point producing a resource if no one can find it. Ensuring the resource is accessible when you share it. Consult accessibility organisations like Vision Australia so that you can be sure that the resource itself is visually accessible, but also consider how you get it out to the community. So, for example, how it's housed online. For example, PDFs aren't great for screen readers and often require downloading, which isn't a very good experience on mobile. And it's also a bit more difficult for certain communities, certain ages. If you can make an online copy, so just taking the information and making it a web page, that can be more accessible and make it easier for people to find. So finally, I just wanted to share some practical tips from myself and the NCIS. I haven't touched on it very much so far because this presentation and session is a bit more about communication and project management, but thorough research is, of course, a must when producing patient-facing resources. There should be a review of the existing literature, include involving clinical and expert perspective from the sources where possible. That's something that we found really important, even just for web pages. I won't go on a rant about SEO and Google and all that, but being sure to cite your sources to prove that you're reputable is very helpful for getting more eyeballs on your content. Next up, resources should be regularly reviewed for effectiveness and to make any necessary updates as time passes and stats or best practice evolves. Between these reviews, it's really valuable to log any feedback you receive so it can be referred back to when it's time to look at the resource. These materials should really be tailored to the patient's needs, and so the perspectives of those who are reviewing or using the resources should always be taken on board where it's possible. And as I said, regular reviews are important to future-proof and protect the content between these reviews, though. It's a good idea to include up-to-date but general clinical information if you can. For example, you might want to discuss a treatment type but not name the specific drug in case that detail changes between reviews. Another example is statistics, which are always really valuable. We find that providing real data is very impactful, and we get a lot of web traffic of people wanting to work out the situation, how common is this cancer, for example. But you want to be really clear when that data is recorded as of to avoid any confusion, and then update it as soon as you have new data. So that's all I have for you. Thank you so much for your time. I guess I'll stop sharing.